In this video, we're going over how to get rid of a stye on your eyelid. And whether you have a stye that's developing right now, this very minute, or if you're somebody who has styes frequently throughout the year, I think you're going to like this. We're going to be answering some questions and answers. Any of your questions, if you're catching this live, go ahead and shout them out. Or if you're catching us on the replay, I think you're going to still get a lot of value out of this because we're going to be covering exactly what causes a stye, the difference between styes and chalazions, and we're going to be going over exactly how to treat a stye at home as well as how we treat a stye in the clinic. And hey, if we've never met before, I'm Dr. Joseph Allen. I am really the host here at Dr. Eye Health, the channel that helps you with the eyes, vision, and finding the best vision products. And if we've never really met before, I completed my doctorate of optometry through the Rosenberg School of Optometry here in 2015. After that, I completed my residency with ocular disease as well as traumatic brain injury, low vision rehabilitation through the Minneapolis VA Medical Center. And then after that, I've been pretty much practicing in a private practice setting here in Minnesota since. But then I even completed my fellowship through the American Academy of Optometry just in 2018. So thanks so much for joining me again. It's part of my mission to help people not just see their best today, but also for the future, for tomorrow. So again, thank you guys so much for joining me. Got a couple of people in the chat want to say hi to. Hey Meg, thanks for leaving a comment. Same thing with Johnny. You guys left a comment today. We're going to be answering some of those. Kaylee and Naleli, thank you so much for joining us here. Now, if you've never met before again, I actually shouted out a couple of tweets as well as some other messages here. And I actually shouted them out earlier today out on Instagram, out on Twitter, and on Facebook, as well here as on YouTube. So you can always connect with me there. Don't forget about that. Now, today again, we're talking about, going to cover some styes, but I want to start off with a question that I actually got from one of my viewers. So this is a question from Random Me. And Random Me I had a small stye. Inflammation went down weeks ago, but the bump is still there. And why? So I think this is an excellent question just to kind of lead into exactly understanding what a stye is and the difference between a stye and what's called a chalazion, because they're pretty easily confused. So a stye is actually an infection on the eyelid. So in the clinic, we actually call them a hordeolum, and this is what a stye looks like. If you've never had one before, good, that's great. If you have a stye right now, might be what it looks like. So a stye, again, is an infection of the eyelid, and usually it's red. It's kind of an angry red color, and it's painful. It's a little bit swollen. Now, again, because it's painful, that's going to be one of the big key differentiators for knowing what a stye is versus a chalazion. We're going to get into that. Now, a stye, again, is an infection of the eyelid, and the most common cause of a stye is actually Staphylococcus aureus. That is the most common bacteria that lives on our skin. It's part of our normal flora. Everybody has it. It's surrounding you. It's on me right now. It's on you. Unless you just took a shower or something like that. But Staph aureus lives on us, and most of the time it doesn't cause any major problems, but it can. And if for some reason you touch staph and it gets on your eyelid and you rub it in, it can get into the hair follicle, and that's what causes a stye. It's an infection of either the hair follicle or one of the associated glands of the eyelid, either glands of Zeiss or glands of Moll. So this is another picture. This is somebody who had a stye on one of the hair follicles. You actually can see one right there in the center of her upper eyelid. It's turning red. It's swollen. It looks like she also has kind of an additional one off here to the side as well. So again, you can have different types of styes or hordeolums. In that picture, it was an external stye. You can have an external stye on the outside of the eyelid, and then you can have a stye on the inside of the eyelid as well. So when it's an external stye, again, it's part of the hair follicle or one of the glands of Zeiss or glands of Moll. But if it's on the inside of the eyelid, those are infections of the oil gland called the meibomian glands. And I'll show you this picture here. This is an excellent picture because if you don't know what the meibomian glands are, they're these little glands that run vertically on the top and bottom of your eyelid. You can kind of see that in this picture here. And actually, I took a picture a couple months ago when one of my meibomian glands was blocked up, and I'll show you guys this picture here. So this is my right eye maybe 6 months ago, And one of my meibomian glands wasn't, I didn't have an infection, I didn't have a stye, but you can see that little yellow bump, and that's one of my meibomian glands clogged up. So that's kind of that's what a meibomian gland is. And if you get an infection, it's going to be internal, closer to the eye. Now, you kind of think, okay, well, if I have an infection on the outside of my eye, that's an external hordeolum or external stye, or if I have an infection on the inside of my eyelid, okay, that's the internal stye. But what's a chalazion then? So again, back to the question of, hey, the swelling went down. Ran to me, asked, hey, my swelling went down. I don't have a stye anymore, but I still have this bump. What is that bump? That is a chalazion. So that's when it's no longer infected and it's no longer in pain, but it can still be red and swollen. You'll get kind of this hard bump on the eyelid. And again, that's a chalazion. And that's actually basically a cyst buildup of oil from your meibomian glands stuck in your eyelid. It's blocked up and it can't get out. And so that's a chalazion. And yes, a stye that didn't fully resolve, if it takes too long to fully heal up, can turn into a chalazion. Now, for the most part, if you have a stye right now, or if you get one in the future, and you feel like, oh, I just need to pop that, if you're one of those people who watches Dr. Pimple Popper, if you've ever heard them, let me know in the chat if you ever watched Dr. Pimple Popper. But people do want to kind of pop these things, but it's in your best interest, as you'll read through a lot of things online, that you don't want to pop these. And it's true. If you do try to pop it, it could actually push the oil debris back further into the eyelid. And so I'll show you another picture. If you don't know eye anatomy too well, the eye is actually kind of broken up into a septum. There's this actual, you can't actually, if you're somebody who has a contact lens, I think somebody asked me this, we're going to get into this later. If you ever get a contact lens, you think you can get behind your eye, it actually can't. It's blocked off by what's called the septum. But if you really have a bad stye and you push on it too hard, and it's possible that the stye could actually push further behind the eye. Now, I've never seen that. It could become a cellulitis, but it's documented in all the literature that you can get a cellulitis from a stye going back further in the eye. Again, never seen it, but it's possible. And if you ever develop a cellulitis around the eye where the infection basically passes into the orbit, it can actually put pressure on the nerve. It can hurt the eye. You can lose vision, but it could even get further back toward the brain, and that could be lethal. So we don't ever want that to happen. So that's basically what causes a stye and the difference between a stye and a chalazion. Hey, just want to, again, give a shout out to everybody. Thanks so much for joining here. It makes me very happy that you guys are looking to kind of learn this kind of cool information and really absorb this content. If you're liking this sort of content, you like learning about this stuff, give me a thumbs up. Please give me a thumbs up for this video. And then let's actually keep going. Let's keep going. Let's actually go into kind of more of the treatments of styes and what we do. So what are the treatments for a stye? Well, the good news for treating a stye is that for the most part, it resolves on its own within a week. About 5 to 7 days, a stye will typically resolve. Sometimes it takes longer, but yeah, for most part, it resolves within 5 to 7 days. Now, with some treatment, whether it's kind of at-home conservative therapy or in-office treatments such as medications, maybe operations, these can sometimes heal up a little bit faster. So we're going to go over that. Now, the first sort of treatments that you'll ever hear about, if you do your own research, if you read textbooks, it's in textbooks as well, not just online, but you'll hear about doing warm compresses. And it's very true. Doing a warm compress, if you've never done one before, there's a couple of ways to do it, and we'll kind of review some of those here in just a minute. But a warm compress on the eye actually gets the fluid, basically the blood flowing around the eyelid a little bit faster. And that gets nutrients, white blood cells to go toward that part of the eyelid and potentially helps heal that infection. On top of that, the heat is going to help really kind of melt the oils that have solidified in your meibomian glands in the eyelid, and any of those solidified inflamed oils are then going to express easier. Again, you don't want to pop it yourself, but if it expresses naturally, whether you're using the heat, the warm compress, then it's going to, the swelling's going to come down and it's going to feel better and it's going to resolve a lot quicker. So number one is go ahead and do warm compresses. When I talk with people to do warm compresses, there's a couple different ways you can do it. You can use just a warm wash rag that's soaked in hot water. That's the most frequent one people do. However, I personally don't find it much. I don't find it very successful because if you ever tried that, it cools off way too quickly. You can heat it up under hot water, and then you put it to your eyes, and then your face is all wet, your clothes might get wet, but then after about 15-20 seconds, I actually timed it out, after about 15-20 seconds it starts to cool off really fast. And so then to do it effectively, you need to reheat it, and then you have to reheat it, and you have to do it over and over and over again. And they've done studies on melting the meibomian glands, the oil glands in your eyelids, and the studies will say about 108 degrees Fahrenheit is the most appropriate, and it has to be done for at minimum of 8 minutes, 8 to 10 minutes. Actually, when you do a treatment for meibomian gland dysfunction through what's called a LipiFlow, I'm not sponsored or anything by that company who makes that, but LipiFlow is a treatment that is done in the office to melt the meibomian glands, and it actually pushes on it, and that's done for 12 minutes. So it needs at least 12 minutes to be effective. Again, with styes, I do recommend at least 8 to 10 minutes of heat, constant heat. So if you're using a warm washcloth, you can do that. That's kind of the easiest method, but you may have to sit there in front of the sink, and sitting there heating it up over and over and over again, and you'll end up doing it a couple of times a day. Now, there's a couple other methods. One of that long-term history has been used using rice and putting that in a sock, or if you already have like a heating pad for your shoulder, you can heat that up in the microwave too. Then you just make sure that it's not hot enough to burn yourself. You don't want to burn your skin. You can always test the inside of your wrist or on the back of your hand before you put it on your face. I have had at least one patient accidentally burn themselves. So again, those are at least the two kind of budget options. I personally actually recommend another product, and I've had another video that kind of reviews that, and I'll eventually hook it up here in the YouTube card above on the replay, as well as in the description below, but that covers what's called a Bruder eye mask. Again, I'm not sponsored or anything by their company, but if you've ever seen a Bruder eye mask, there's a couple of different versions of these, different other companies that you can buy them. Actually, they're even at like Walgreens and CVS pharmacies. You can find similar ones, but the Bruder eye mask is a little bit more unique because they have special beads. They actually have a patent on the bead technology inside, and it makes that so that when you heat it up in the microwave, it absorbs moisture from the air and it traps the moisture, so it releases a moist heat to the eyes. But they also made it with silver. They have silver threading in the actual fabric itself, and that silver lining, I don't know if you guys know this, but they actually have silver thread even in socks. Some types of socks have silver thread because it actually helps eliminate odor, and it's somewhat antimicrobial, so it prevents microbes from growing on it. So there's some extra advantages there. Because they have the patent on the heated beads here, it's washable, where a lot of the other products that are on the market, they're not washable because it's basically filled with like sand or silica sand, and it can actually absorb the water, and then it ruins the mask, so you can't wash all of them. And that's one of the reasons why I like Bruder so much. There's a couple other products out there. I know somebody asked me once, hey, I don't have a microwave. I don't like to use a microwave. I don't have a microwave in my house, or I travel a lot. I don't have access to a microwave all the time. Is there something else that works? And there is another product. This one, my buddy kind of told me, another eye doctor told me about this one. This one is called the EyeGenie. This one, you have actually these little heating pads that you have to rip open, and then as soon as they're exposed to air, they start activating and getting really hot. And that lasts for about a good 15 minutes. The heat isn't as warm as you can get if you use like a Bruder mask or something you put in the microwave, because you just added another 10 seconds and it gets hotter. But the EyeGenie does work as well. Those are available online. Some eye clinics will have them as well. Another one that I've recently just tried, because once I started talking about warm compresses, people started telling me, hey, what about this one? What about this one? Well, this one is called TranquileEyes, and this one is like probably the most advanced warm compress I've ever seen. So if you're somebody who gets a lot of styes, maybe you can want to consider investing in one of these. This one's really good for dry eyes as well, but it has a couple of different things. It comes in a full sleep mask, so it doubles as a sleep mask. It's really cool. But this one you actually have separate, it's like a kit. You have to put together, you actually wash or moist or kind of, you soak these little kind of covers. And then you heat up the padding inside, either through the microwave method, or they have another one where you snap it and it heats up, kind of like a heating pad in the winter. And then you actually put it inside the little sleeve, and that goes back in the eye mask. And again, it holds the heat pretty good for a good 15 minutes or so. So that's another one that you could always consider. And again, I'll hook these up in the YouTube description below. Now, again, doing warm compresses, however you want to do it, again, you just want to do it for at least 8 to 10 minutes, and you can probably do it at least 4 times a day. And you can actually do it more often than that. You're not going to really hurt yourself by doing it too much, unless, of course, it's too hot and you burn yourself. Now, you're probably thinking, okay, this is great. I do warm compresses. Well, then now what do I do? The next thing to do is to do a type of actual lid massage. And there's other ways to do a lid massage, but that's to kind of encourage the drainage of this stye that's been locked up. So you don't want to, again, you don't want to try and pop it, but you can do a gentle massage, and there's a couple ways to do this. So one technique that I was taught by one of my professors was just to do a gentle kind of rotating motion, just kind of gently push on it, and that'll encourage it to release. But when you think about it, the oils are trapped up in the meibomian glands, and the glands run vertically. So I think of it kind of like a tube of toothpaste. I like to actually start at the top and roll my finger down onto it. I roll my finger down onto it because if you're going to get any of that oil to release, you want to push it down from the top eyelid, or if you're on the bottom eyelid, you want to roll your finger upward. So by rolling it upward or rolling it downward, you're going to influence those oils to release out the opening. Otherwise, it's kind of like trying to get toothpaste to go out the back side of the tube. You don't want to do that. It's not going to be that successful for you. So again, that's kind of the warm compress followed by the lid massage. That is the two best things you can do at home to help these kind of heal up on their own. Now, one other kind of good tip for anybody who gets these frequently is to really clean your eyelids. One of the main reasons, again, the main cause of a stye is the infection of Staph aureus, the Staphylococcus aureus. So cleaning the eyelids really well to get rid of any of that bacteria, anything irritating the eyes, is going to be really helpful. Now, there's a couple of ways you can do this. People for a long time doctors have recommended, hey, just make sure you wash your face with mild soap, whether that's baby shampoo or something with a no-tear formula that's non-irritating. That I've done that myself, and the downside to that is that I have really sensitive skin, and so I use that type of detergent on my skin. It actually dries it out a lot, so I'm not a big fan of that method. There are pre-packaged versions. I know Ocusoft. This video is not sponsored or anything by that company, but Ocusoft, almost every doctor's clinics will have these. Almost every pharmacy will have something like this. They're also available online in bulk if you want to look into them. But Ocusoft has lid scrubs. This is the original formula. They even have like a super powerful formula. But these are great because you can just open them up, clean your eyelids, and it's like a wet wipe, and it's all done. It cleans your eyelids, get rid of all that bacteria, breaks up any of the oils that have solidified, kind of like dandruff on your eyelids, and it cleans it up. So there's a couple of different brands. Again, there's Ocusoft. Sustain makes one. Those are good too. Another thing that's kind of taken wave in eye care now is something called hypochlorous acid. And has anyone really seen this before? If you're in the chat, let me know if you've ever seen hypochlorous acid before. So this is another Ocusoft product. There's a couple of different ones. So Ocusoft makes one that's available over the counter, and there's a couple other brands over the counter as well. And then there's actually prescription ones. So this is a prescription hypochlorous acid called Ocusoft. And again, I'm not sponsored to mention these or anything like that, but I'm just letting you know that there's available. Same another one called Avenova. Avenova's been out around for a while too, but those ones you need a prescription from your doctor. And so the prescription ones are a little bit more expensive. Not entirely sure why why some are prescriptions and some are not. I've done a lot of research into it, trying to figure it out. And the only thing I can figure out is that the ones that are prescription are made through, they actually have a patent on the way they make it. But the formula between the ones that are over the counter and the formula for the ones that are prescription based, they're all made of basically the same. They're all made of the same hypochlorous acid. Now, if you don't really know what hypochlorous acid is, it is a cleaning, basically a bactericidal compound that's a spray that you use to clean your face. These are what these are specifically made for eyelid cleaning. But hypochlorous acid's been used for a long time to basically disinfect wounds like diabetic foot ulcers and other kind of treatments, even during surgery. So this has been on for a long time, and again, it's great because it kills a lot of bacteria and it's very safe on tissue. So if you're someone who has very, again, sensitive skin like mine, hypochlorous acid is great at cleaning the face. So you can buy this hypochlorous acid. You can clean your face every day with it, and you will hopefully prevent yourself from getting styes again in the future. Now, again, those are three things that you can do at home. Warm compresses, doing the lid massage, and then just cleaning your face on a regular basis. Your face is going to be a little bit cleaner, and you're going to get less styes. If you do try any of these methods to clean your face and you get really kind of dry skin, the next method is just to make sure that you use a moisturizer, something that says non-comedogenic. That's basically the white and blackheads that can form if you're using an oil that gets soaked up into your oil glands. You don't want to be giving yourself pimples. So make sure that again, if you're moisturizing with any sort of moisturizer in your face, that it says non-comedogenic. I'm not a dermatologist, but I've studied enough to know that. Now you're kind of thinking, okay, this is great. I know how to do stuff at home. And now, what about at the clinic? What does your doctor think when I go into an office visit with a stye that's just not going away? So the first thought is topical antibiotics. So do topical antibiotics, such as an antibiotic drop or a cream, does that actually help? A topical antibiotic in some literature has said that you could use it. As a professional, I see it, oh, you could use it. But most studies all agree now that topical antibiotics do not really help. They don't really help unless you just have a bad amount of bacteria on the eyelid. If you have a lot of bacteria on the eyelid, such as blepharitis, is inflammation of the eyelid, then perhaps the topical antibiotics can at least kill off some of that bacteria. But in large part, the topical antibiotics don't really work. So a lot of clinics, doctors won't prescribe these. What about oral antibiotics? These are your oral antibiotics that you take, let's say, if you had a bad lung infection or something like that. An oral antibiotic is kind of the trend now. If you have a bad stye that's internal, like an internal stye, or perhaps you have a chalazion and the oil glands have solidified and you have kind of a cyst, oral antibiotics not just kill the bacteria, but they actually, some oral antibiotics have an anti-inflammatory effect, specifically one called doxycycline. Now, doxycycline's been on for a long time, usually pretty safe. We don't prescribe it for children. Doxycycline, again, you do need a prescription for it, but it helps not only kill the bacteria, the infection, but then again, it has some anti-inflammatory properties that help change the oil glands of your face. And you'll actually see dermatologists prescribe doxycycline for people with bad acne. We usually prescribe it at a low dose, about 50 milligrams, maybe 20 milligrams twice a day, for usually an extended period of time. And at a lower dose, you don't get as much side effects from having the antibiotic. Sometimes it can give upset stomach, some issues like that. But those are some big ones. More recent publications will say azithromycin is another one that could be used as similar effect. Also, I know a lot of doctors will prescribe what's called a cephalosporin or a cephalexin medication. These are all oral medications that can be used, and they usually have really good effect. And that's why a lot of times I like to offer it as an option to my patients who are interested, and they're like, hey, I'm sick of this stye, I want to get it to go away. And so I'll mention, hey, we could try an oral antibiotic and then just follow up and make sure everything heals up. So again, that's basically how we treat a stye. Those are our options. And again, most of the time, styes do resolve on their own, 5 to 7 days. But what about chalazions? We mentioned that before. If you have a chalazion, what do you do about it? Well, again, chalazions, you can do the warm compresses as well. Warm compresses frequently, at least 4 times a day, should help resolve a chalazion. However, some people, the chalazions are just either too big or they're too thick, and they just won't go away with warm compresses. Or with oral medications, because again, we'll prescribe the oral medications to see if that helps. Now, if you have a chalazion that's not going away, they can be surgically removed. It can actually be cut open and drained. It has to be done a certain way, so I do not try this at home, but it has to be cut a certain way so it doesn't scar. It's potential that when they cut it open, they can actually, they use it looks like a microscopic ice cream scoop. So they cut open the lid and they actually scoop out the solidified oils. Now, the issue is that when this heals, the scarring can actually damage the neighboring meibomian glands. And if the meibomian glands get damaged, they can die off, and that can lead to further problems with dry eye disease. Another option that could be given to you is doing an injection of Kenalog, which is a corticosteroid, which helps decrease the inflammation. And this works really well. I've seen it work just fantastic for some people. However, if you have dark pigmented skin, Sometimes it's not the best option because that steroid can actually make your skin turn a lighter color, and that can look kind of weird, and people aren't happy about it. Also, there's some other issues with steroids as well, like necrosis, and they're all very rare, but that's an option. So those are really the big options in the clinic that you could consider to remove chalazions. But thanks, guys, for that was pretty much the whole kind of presentation on styes and chalazions. Now let's get into some more Q&A. Now I have a couple of questions. Some people I want to give priority to because they responded to my questions this morning when I was putting it out both on YouTube as well as on Twitter and things like that. So first one up here, we have Johnny Alvarez. Johnny, if you're in the chat, I think you are here. Thanks so much for watching. Question is, what do I do if my contact goes up into my eyelid? Well, that is an amazing question, and it's a very good question. I'll probably do a video on like how to do this, how to get it to kind of move back into place. So yes, your contacts can sometimes drift upward underneath your eyelid. Now, the truth is, people are worried all the time. They're like, "Oh no, it's going to go behind my eye." Again, because of how the structure of the anatomy around the eye is, it can't go behind the eye, but it can get stuck way up there. So you can, of course, learn how to remove it yourself. I personally like to look down, and I try to push on my upper eyelid and try to find it and like kind of coerce it downward. You kind of push it downward until it gets low enough where you can look up and blink a few times, and usually it'll fall out. It can be pretty tough. I don't recommend anybody tries to use a Q-tip or anything to get it out there because you're probably just going to end up scratching your eye, and then you're going to be in the clinic seeing me so that I can treat the abrasion. If for some reason you can't get it out, you absolutely can't get it out yourself, go to your eye doctor. We've got drops that'll numb the eye, make it feel better, and the drops will have a little bit of fluorescein sodium in it. It makes it look yellow. If you've ever had those drops at your eye doctor before, the fluorescein sodium actually gets soaked up into soft contact lenses, and that'll actually highlight the contact lens. It'll ruin the lens, but it'll highlight where it's at so the doctor can get it. Even if the contact lens rips and there's just little pieces stuck up there, we can still see the pieces and we can get them out. So that's always kind of your other resort that you can go to. RGPs, same sort of thing. If it gets stuck way up there, I just look the same thing. I look down and try to coerce it down. Oftentimes, frequent blinking. You can, of course, try to wash the eye out if you have a bottle of eye wash, or if you have an eye wash station at work, you can always try that too. No, the sodium fluorescein does not soak up into rigid gas permeables. No, so that was a great question, Johnny. Thank you so much. Hopefully you found some value out of that one. Now, the next question, we have Emily Mogensen. I don't know if Emily's in the chat here right now, but she asked the question. It says, I have dry eye, and I feel it so much worse when I wear glasses. Why would that be? And it's kind of tough. If you're not here right now, so there's dry eyes is a very complex topic, and we're going to do a lot more videos on dry eye in the future. But so dry eye, if you have, I'm not sure if Emily is talking about like, hey, that she wears contacts and her eyes feel less dry when she's wearing contacts. Maybe that was what she was going for. But it could just also be that, hey, when you're wearing glasses, let's say eyes are dry, wearing glasses, and suddenly you're more aware of your eyes because something's touching your face. If you normally don't wear glasses, something's touching your face, you could be just more hyper aware about your eyes. But if in her case, if she's wearing contacts, some people have exposure issues where their eyelids don't close all the way. They're incomplete blinkers. I'm one of those people. And you could have exposure problems to the eye, and the eyes may dry out faster. But with contact lenses, you actually have this extra shield, this buffer on the eye, and that can actually protect the eye from dryness. It's kind of counterintuitive sometimes, but it is actually using contact lenses to prevent dry eyes. Even soft lenses can actually be a therapy for dry eyes. I got a couple of good questions coming in. We're going to get to those just in a moment. But I'll get there just in a second, but let's actually go to one more question that I needed to kind of get to, and that was Meg G. Meg G, if you're in the chat, I know you were here earlier. Thanks so much for watching and chatting. She asked, what's the best eye drop for eye allergies? So this is excellent this time of year. Right now it's the springtime. Eye allergies are kicking up, and eye allergies, there's so many things that can cause the feeling of allergies. In general, allergies are an itch to the eyes. If you are somebody who knows that you have allergies or sneezing, all that stuff, you can have try over-the-counter systemic allergy medication. Sometimes those work. But eye drops, specifically for allergies, you'll find a lot at the store. There are a lot of different brands. Some of them have what's called Nefazoline, or Nafcon A is a brand, but Nefazoline is a drop that actually constricts blood vessels, so that helps get rid of the redness from allergies. But the problem, if you've ever seen my other video on getting the red eyes out, that medication actually causes a rebound effect. So Nefazoline is an older medication with a mechanism that causes a rebound problem. So after about 4 hours of using it, the eyes are going to get red again. So then you're going to end up using the drop again, and it becomes like this vicious cycle. Now, for allergies, the two over-the-counter drops that I prefer, they are mast cell stabilizers as well as an antihistamine combined. The active ingredient is called ketotifen, and they are the two brands. Again, I'm not sponsored by these companies that make this. One is called Zaditor, starts with a Z, and it's in an orange bottle. And the other one is called Aloe, and that's by Bausch & Lomb. And again, it's the same active ingredient. It's generic. It's over the counter. Runs you about $12 usually here in the US. But those for the most part work really well. Usually using it once to twice a day, and it'll say right on the bottle how to use it. Now, the only thing, caution about any sort of eye allergy drops, is that you look on the back and make sure, hey, does it say anything about pregnancy? If you're a woman, if you're worried about pregnancy, these are, most allergy drops are pregnancy category C. Now, interesting enough, if you don't know much about category C, the different medications are graded based on their risk of causing any birth defects. Now, the grading is actually changing, but right now, category C means basically that it either hasn't been proven to cause defects, or that the testing hasn't been completely conclusive for humans. So basically, if it's category C, it's not really recommended. But if it's category B, and there is one prescription medication for allergies called Lasticaf, and you can always talk to your doctor about that, that is category B, and that's safer to use during pregnancy. There are other medications. If you have really bad allergy problems, talk to your doctor. We can get you steroid medications or other prescription eye drops that are going to be better for you. But certainly there are some eye drops for allergies that are over the counter. So all great questions. These were excellent questions. Now let's go into the chat. I had a question from Blue Green that said, I have never had a stye, but I do have a white bump on my upper eyelid by my eyelashes. It never gets swollen. It's just there. Should I be concerned? It's tough. I can't give you personal medical advice because I cannot. You need to be examined by a doctor to know exactly what it is, because there's so many different things that it could cause. It could be the cause of it. So I do encourage you, when you have an issue like this, go see your doctor. That's what they're there for. It's going to be the best way for you to get the best treatment that you need. How dangerous is diabetic retinopathy? That's a good question, Don. It's fairly dangerous. At least in terms of my profession, diabetes is a huge part of our education and understanding how it affects the eyes. I do have a video on diabetic retinopathy. It's pretty extensive. It's like a 20-minute long video. It was one of the first videos I ever did on here on YouTube, but it goes over what a doctor sees during an examination and what we're looking for. The biggest concern, long story short, for diabetes hurts your blood vessels in your entire body. Over time, especially for people who aren't really well controlled for their diabetes, the blood vessels can leak. The leaking blood vessels cause swelling of the retina, which can cause loss of vision, and that can happen at any point. Even people who are well controlled can potentially have the leaking into the eye. We call that macular edema or diabetic macular edema. But then the other blood vessels in the eye, they call new blood vessels to grow inside the eye that we call neovascularization, and that can cause problems like glaucoma. It can cause a scar tissue to form on the eye that can cause a retinal detachment. And people can not only lose vision permanently, but people go blind from diabetes. So it's very important, if you know someone who's diabetic, if you're diabetic yourself, follow your doctor's recommendations, take medication, make sure you're following your diet the best you can, lose weight, stay active. There's a lot going on with diabetes, and so we take it very seriously. So yeah, that's a great question. So yes, long story short, diabetic retinopathy can be dangerous to the eye. If you're bleeding in the eye, then we also know you're basically bleeding in your kidneys and potentially bleeding in the brain. So it's really important to have at least an annual eye exam when you're diabetic. Um, so other questions, can you be born with a stye? That's a kind of funny question. I suppose you could. You could actually be born with a stye, but when you're born, a long time ago, they actually used to give people like silver nitrate, babies when they were first born, to prevent infection. I don't want to go fully into that right now, but nowadays they basically slather newborn babies with erythromycin ointment on the eyes, just to basically prevent any sort of infection on the eyelids. Um, so any other good questions? We have a maybe papilloma. So papillomas, yeah. So papilloma in general is basically a if you've ever had a skin tag, yeah, like a skin tag around your neck or on your face. Some people get them more than others, but papillomas are very common. Not a huge medical concern, but a lot of people like to get them removed. And you can certainly do that. It's pretty simple to do for most doctors to complete that. Depends on where you're going. Some states allow doctors of optometry like myself here in the United States, they let us remove those. Other states, they don't. Um, it's something part of our education, but again, our profession is legislated, so it depends on where you live. Um, Another question. I have a small chalazion. Can I still wear contact lenses? In reality, the chalazion's not a real major concern other than the fact that it's a cyst. It can be unsightly. If it gets really big, it can push on the eye and cause induced astigmatism. So your vision, your correction may change a little bit based on the location of that stye. But if you're really that concerned, again, consult with your doctor about it. Maybe get the chalazion removed or healed up, or talk to them about how your contact lenses are working. So those are all fantastic questions. Thank you guys so much for joining me here today. I think we're going to kind of close out here. I want to go ahead and share eye health question of the day for everybody. The eye health question of the day: what was your favorite part of this video? What was your favorite kind of tip or walkthrough, something that you learned? Go ahead and share in the comments section below. Thank you so much for joining. Again, I am Dr. Joseph Allen here from Dr. Eye Health. The channel helps with the eyes, vision, and finding the best vision products. If you want to check out other cool videos from Dr. Eye Health on things like eyelid styes, eyelid hygiene, I do have a whole video series on eyelid hygiene that's coming out, as well as out right now. So check those out, as well as other videos from Dr. Eye Health. You can check those out here. Again, thank you so much for chatting here, and we'll talk to you soon.